Patient with a suspected block at the lower end of the bile duct, probably a small tumor in the ampulla. This was suspected. We are doing endoscopic ultrasound, and a very careful examination of endoscopic ultrasound told us that there is a very small lesion which is affecting the bile duct and the pancreatic duct into the ampullary area, and it is not invading the major ducts. So with this kind of information, we can take out small ampullary, this is the bile duct and magnification. We are seeing the pancreatic duct up to the ampulla, and you can see that this is a small measured area which is 11 by 8 millimeter. This is the ampulla of water of a small lesion. So what we are going to do is, if we take a biopsy, we may not get enough material from there. That's the bile duct, that's the pancreatic duct is a little prominent, the whole bile duct seen on endosonography. And now you see some evidence of gallbladder here on endoscopic ultrasound, some small imaging microliths and some cholesterosis changes. So there are no stones as I see. There could be very, very small, tiny imaging microliths, but the pancreas looks fine. The liver looks okay. This is the liver evaluation from the stomach with endoscopic ultrasound. And we did not see any lymph nodes. I'm seeing the pancreas from the body of the stomach. So again, to the viewers, the best investigation to see gallbladder, bile duct, pancreatic duct and pancreas is endosonography. And this is a small tumor. You can see here it's a benign tumor, mostly look like. So what I'm going to do now, I'm going to do something called ampulectomy. So we are going to take out this tumor with endoscopic technique. And this is possible after a proper thorough evaluation. You can see I'm going down deep, and we are going to take out the whole damn tumor endoscopically. So this is how we take out the whole tumor endoscopically. And this was the end of the treatment for this patient, who otherwise would have ended up with a major surgical intervention called a Whipple operation. So we are going to take this tumor out and send this for histopathology. Now it is mandatory that whenever you remove a tumor from the ampullary area, it is important that you cannulate the pancreatic duct and the bile duct and make sure there is no residual tumor left in the sphincter. We are going to now cannulate the pancreatic duct. You can see I'm cannulating the pancreatic duct, because it's important to put a small stent in the pancreatic duct, otherwise patient can develop pancreatitis. So I appeal to viewers that whenever you suspect a bile duct or a pancreatic duct pathology or ampullary pathology, I'm doing actually a pre-cut sphincterotomy. So I'm cutting the sphincter here, you can see, with a needle knife. Very, very careful, precision job we have to do. And then we will find a small opening. Through that small opening, we will cannulate the desired ducts. So now our guide wire has gone inside. I am going inside the pancreatic duct. You can see that on X-ray. We've gone deep in the pancreatic duct. And now we will not inject contrast, or will just inject very minimal contrast to make sure that our position of guide wire is perfect. We leave a small metal wire, and we are going to leave a very, very small 3 French pancreatic stent to make sure that there is no post-ampulectomy pancreatitis in this patient. So this is the kind of precision job, high definition endoscopy, high precision endoscopy with a lot of experience can do for the patient. And I'm putting a 3 French stent in the pancreatic duct. This is the end of the procedure for this patient, and he is completely cured. So all ampullary tumors do not remove Whipple operation. We can do endoscopic resection as well, as you can see here.